In your Health Watch, if your leg muscles ache or burn when you walk or exercise, you may not be getting enough blood flow to your lower legs and feet. It's called peripheral artery disease, or PAD. As Beth Galvin reports, it is a major reason many people end up needing amputation surgery.
Outside the Lou Walker Senior Center in South DeKalb, a quick blood pressure check, not just of arms, but also ankles, because this is a screening test to detect blood flow blockages that could be caused by peripheral artery disease, or PAD. And 47-year-old Kimberly Campbell likes what she's seeing here.
This could change lives, and I definitely feel like it would have changed hers.
Campbell's talking about her mother, Gertrude Sims Campbell, who passed away at 78 in 2020 back home in Mississippi.
Where I'm from, they didn't have that kind of screening, so she wasn't offered screening. In spite of her having a lot of risk factors and being diabetic, no screenings were done.
But Dr. Edward Wingfield, an interventional cardiologist with Robert Wood Johnson University Hospital in New Jersey, says many of us don't know much about PAD.
Even some of our physician colleagues, we don't screen for peripheral artery disease as aggressively as we should.
There are warning signs like numbness, painful cramping, or weakness in the legs, sores or wounds on the feet or legs, slow toenail growth, and shiny skin or hair loss on the legs. But Dr. Winfield says people can overlook these symptoms.
They may feel that this leg pain that they get when they walk is sciatic nerve pain. This is from my back. I'm having nerve pain from my back.
Or he says they may think they have arthritis pain, but PAD is often just the tip of the iceberg.
Typically, patients who have PAD also have diabetes, high cholesterol, they're smokers, they have heart disease.
Campbell's mother was diagnosed with diabetes in her late 40s or early 50s, and as a Black American, she was twice as likely to develop PAD and 4 times more likely to require a lower leg amputation than a white woman her age. And that's what happened. She developed foot sores that, with a lack of circulation, became severe wounds.
She had worn a shoe that had rubbed against her foot, and she had some wounds on her shins. For years, she went back and forth to the wound care center.
They tried surgery to restore the blood flow, but it didn't help.
When they unwrapped her leg, it was raw. Blisters came on it, and basically it was like nothing they could do but amputate.
After losing part of both her lower legs, Gertrude Campbell spent her final years largely in a wheelchair, and that's why her daughter is here for this screening. It's part of Save Legs, Change Lives, a campaign sponsored by Janssen Pharmaceuticals. The goal is to detect and treat PAD earlier, especially in African Americans, long before amputation is the only option left.
Please notify your doctor. Maybe ask for some screening. My whole purpose is to empower other people.
Beth Galvin. Love what she's doing, and it will save lives and limbs.